Christina and I am a student at Eastern Kentucky University in the Family Nurse Practitioner track. I've prepared a project proposal to determine the effectiveness of incorporating motivational interviewing into standard smoking cessation programs to improve adherence to smoking cessation. First, it is important to understand what cigarette smoking is. Cigarette smoking is the inhalation of smoke from burned tobacco. Cigarette smoking is the leading cause of preventable death in the United States, causing more than 480,000 deaths each year. Cigarette smoke contains more than 7,000 chemicals, including hundreds that are toxic and about 70 that can cause cancer. Next, it is important to understand the intervention, motivational interviewing. Motivational interviewing is a new method of counseling that may increase effectiveness of smoking cessation programs. Motivational interviewing is a collaborative, patient-centered form of communication designed to guide and strengthen motivation for change and focuses on the individual's own values and concerns. The purpose of this project proposal is to determine how motivational interviewing affects smoking cessation in current everyday smokers within 1 year of implementation. The target population for this research project is current everyday smokers in Kentucky. In 2014, the CDC ranked Kentucky as having the highest percentage of active smokers compared to any other state in the United States, meaning there will be a large population of possible participants for this project. This problem is significant to the family nurse practitioner because they will treat many patients who are ready to quit smoking cigarettes but are struggling to do so. The family nurse practitioner should offer their patients support and information about resources available to help with smoking cessation. There has been a lot of research performed to support this project proposal. Lindquist et al. 2013 found a significant difference between motivational interviewing with a 19% quit rate versus standard treatment with a 14% quit rate for continuous smoking abstinence. Calabro et al. 2012 found that there is a significant difference between motivational interviewing with web-based support with a 20% quit rate versus standard treatment with a 10% quit rate for smoking cessation at 12 months. Mujica et al. 2013 found that at 3 months follow-up, 6 nurses in the motivational interviewing group were successful with smoking cessation, while only 1 nurse in the standard treatment group was successful. Muwaji et al. 2014 found that at 6 months follow-up, self-reported abstinence was more than twice as high in those using motivational interviewing versus standard care. Linson-Hawley et al. 2015 completed a Level 1 systematic review, including 28 studies published between 1997 and 2014, which involved over 16,000 participants. Motivational interviewing was conducted in 1 to 6 sessions, with the duration of each session ranging between 10 to 60 minutes. According to Linson-Hawley et al. 2015, motivational interviewing versus brief advice or usual care significantly increases successful smoking cessation. For the proposed intervention plan, all patients seen by a primary care provider during the recruitment period at Norton Louisville Primary Care Center will be assessed for smoking status at every visit. Patients screened positive for current everyday smoking will be approached for participation in this research project. A verbal script will be used to ensure consistency with recruitment and explanation of project procedures. Those interested in participating will be assessed to see if they meet the inclusion criteria. After meeting inclusion criteria, participants will then be assessed to make sure they do not meet any of the exclusion criteria. Next, informed consent and project procedures will be given to participants and reviewed. After answering all questions concerning the study, participants will be asked to sign informed consent to participate. After signing consent, participants will be asked to complete a baseline demographic survey and the heaviness of smoking index. After completing all forms, participants will be asked to complete a salivary cotinine test to confirm smoking status prior to beginning this study. After confirmation of smoking status, participants are accepted into the project and can schedule their first session. Participants will attend 12 motivational interviewing sessions with a counselor. Each session will last between 30 to 60 minutes and will focus on smoking cessation. Participants will meet with the counselor once a month for 12 months. At the beginning of every counseling session, participants will complete a salivary cotinine test to determine smoking cessation status. After the final counseling session, data will be gathered and analyzed for significance. Data gathered about smoking cessation status of participants before and after the use of motivational interviewing will be used to determine if motivational interviewing increases smoking cessation. For this project proposal, smoking status is measured through salivary cotinine testing. For salivary cotinine testing, participants will hold a swab under their cheek for 2 minutes to collect saliva that will be tested with the salivary cotinine test kit. Anyone measuring more than 10 parts per million on the salivary cotinine test kit will be labeled as a current smoker. Participants are tested for smoking status at every counseling session, so once a month, and at the end of the project. In conclusion, the research performed by Lindquist et al. 2013, Calabro et al. 2012, Mujica et al. 2013, Luwaji et al. 2014, and Linson-Hawley et al. 2015 demonstrate the effectiveness of motivational interviewing to improve smoking cessation within 1 year of implementation. All studies demonstrated many strengths and weaknesses, but were all valid and reliable. The family nurse practitioner should refer their patients to programs that incorporate motivational interviewing to increase the success of their patients' smoking cessation attempts. Motivational interviewing should be implemented into standard smoking cessation programs to improve the effectiveness and success of every program. Thank you so much for your time. I hope you have found this presentation to be beneficial to your future practice.